5 reasons autistic women and girls are underdiagnosed. The first step to improving care for autistic women and girls is to understand the challenges they face. Autistic people who were assigned female at birth are often undiagnosed, underdiagnosed, or misdiagnosed for several reasons: misdiagnosis and underdiagnosis. Autistic women and girls are often misdiagnosed with conditions like borderline personality disorder, depression, anxiety, PTSD, or bipolar disorder. These conditions can co-occur with autism, but often symptoms of those disorders can be better attributed to autism. In the case of PTSD, it can occur as a result of existing as an autistic person in a neurotypical world. Women with self-injurious behavior may be diagnosed with BPD without consideration of the potential link to autism. Anorexia and other disordered eating conditions is highly prevalent among autistic women. Evaluating them for autism may be necessary to treat the cause rather than the symptom. Over 24% of our survey of autistic adults reported being misdiagnosed. Over 90% experienced both depression and anxiety, and 34% have had an eating disorder. OCD, ADHD, PTSD, and BPD were also reported as common co-occurring conditions. Masking tendencies. Autistic masking is when you hide your thoughts, feelings, and behavior to try and fit social expectations. It can involve mimicking neurotypical behavior and speech patterns, suppressing stims, and can lead to cyclical burnout. For a variety of reasons, girls are often socialized to mask their autistic traits better than boys. When it comes to detecting autism, girls are often overlooked because we get too good at hiding our atypical behaviors. Additionally, media tends to portray autism as a male condition, which perpetuates the myth that girls cannot be autistic. Because of these factors, even medical professionals can be ignorant of how masking can influence how autism presents itself in women and girls. Phenotype differences. A phenotype is a word used to describe how a person looks, behaves, feels, and learns based on their genes. Girls may be quieter and more compassionate seeming than boys, for example. They may also appear better at socializing, and their special interests may not strike healthcare professionals as unusual. For instance, a little girl's fascination with butterflies may slide under the radar as a gender-appropriate neurotypical thing, when really it's an autistic special interest. Shortage of specialists. There's a shortage of specialists who are knowledgeable about treating autistic women and girls. As a result, healthcare professionals may downplay or dismiss their challenges, gaslight them, and question their understanding of autism. An astounding 84% of autistic adults recently surveyed by Autism said finding someone to conduct the assessment was a major challenge in their journey. Dr. Ayarochi, a psychologist who specializes in autism, told us this in a recent interview. There are a handful, if that, of people who are actually doing adult assessments in the province. The demand is getting higher, but their expertise is not there. It's slowly happening. One person like me can only do so many because I have a part-time practice, and they take a lot of time. Lack of research. There's a significant gap in the research on autism in women and girls, which leads to diagnostic oversights. It also means doctors, therapists, and other healthcare professionals are not educated on the unique ways autism can present in women and girls. Dr. Ayarochi had this to say: there's limited research in how you do autism assessments in adults. All of us who do assessments on children have kind of adapted and made our own set of tools, our own sort of format for how we do adult assessment. Because people are kind of scrambling to figure out how we do it properly. There are no standards or guidelines. There's very little in the way of research evidence to suggest this is the tool, this is how we use it, this is how we do it. And that gets in the way. To help more autistic women and girls get diagnosed, we need to train healthcare professionals to support people with different types of brains and ask for enhanced support from the government.
Visit autismbc.ca/late not less